The U.S. is now on track to break its daily COVID-19 infection record for the third time this year. So what does that mean for the military and all those travel restrictions that were eased in recent weeks? Could they come back? Mike Gooding asked one of the Navy's top admirals.
Back in March, Defense Secretary Mark Esper put in place travel restrictions to limit the spread of COVID-19, to protect lives and to preserve mission readiness. For the Navy, the stop movement orders created a backlog of about 42,000 sailors who were scheduled to move, creating a financial burden for some families. Then in July, a pair of administrative orders from the Chief of Naval Operations laid the groundwork for some movements to resume. But what happens if the nation's collective medical condition worsens again? The United States is already the most affected country, with more than 8.2 million diagnosed coronavirus cases and at least 220,000 deaths, and hospitalizations are on the rise in 41 states. The Navy's Chief of Personnel, Vice Admiral John Knowles, says to protect the more than 344,000 active duty sailors, his branch could pivot on the local force health condition designations if necessary.
And so if we have an area that we take to Bravo and then we need to take it back to Charlie, then we will certainly do that to keep sailors safe and by extension, their families.
And the Admiral said the Navy is in a far better position today than it was in the spring, when the USS Theodore Roosevelt was hit with more than 1,200 COVID cases.
We've learned a lot, and I do honestly believe that the safest place to be right now from the perspective of COVID is on a U.S. Navy ship underway.
Mike Gooding, 13 News Now.